Combating intestinal parasites in the community. This will be an overview of the problem and impact on health with instructions and recommendations for deworming programs. Intestinal parasites, the scope of the problem. It is felt to be the most common infection worldwide. Prevalence rates in poor communities can be over 90%. The WHO estimates that 880,000 children are in need of treatment, meaning regular mass treatment of intestinal parasites, and it is estimated that over 300 million suffer severe impairments because of high worm burdens. Now, intestinal parasites, soil-transmitted and waterborne intestinal parasites are our focus today. Human parasites also include blood parasites such as malaria and skin parasites such as scabies. The World Health Organization has a large amount of data on the public health problem of soil-transmitted helminths or intestinal parasites. The WHO recommended strategy is mass drug administration once or twice a year depending on the worm burden. Also, of course, promoting improved sanitation systems and education. The map in the center of this page is interactive and gives estimates of need for treatment of children in each country. Note that this information is for preschool-aged and school-aged children only. We recommend deworming the entire community, not just the children. Also notice that this map is 2018. These things are updated periodically, so always go to the most current information. And note the webpage for WHO neglected diseases to connect with this information. Intestinal parasites cause illness and death from anemia, malnutrition, impaired physical growth, both stunting and wasting, poor intellectual development, and infections. So where do intestinal parasites come from? They enter the body through food and water that has been contaminated by human waste, feces, or sometimes urine, or through skin if the person steps or sits in mud or water that contains human or animal waste. Many people infested with intestinal parasites are not clinically ill, but can still spread the disease by not using latrines or toilets. It's interesting that there's mythology that arises about the origin of intestinal parasites. I remember in my childhood my mother telling me it came from eating raw bread dough. And I've heard women in communities with high incidence of parasites say they think it comes from they come from eating bread, or they have other theories. But the fact is, it is a disease of poor sanitation. And in our own country, at the turn of the last century, we had a very large problem, especially in the South, with hookworm infections. That is no longer a public health problem in our country because of a major effort on the part of involving the Rockefeller Foundation and public health people to control the intestinal parasite problem in our country. And the same kind of mass attention can achieve the same goals in other places. Now, children with swollen bellies usually have severe malnutrition and a large burden of intestinal parasites, but don't assume when you see this swollen belly that you know what it is from in that individual. Parasites compete with children for food. Children with heavy worm burdens may be forced to share 1/4 or more of their daily nutrients with their parasites. Think about that for a minute. The parents are working very hard to put food on the plate of the children, and the parasites eat first. Deworming promotes child survival. Therefore, national level mass deworming campaigns have been implemented in many developing countries. 1 tablet of deworming medicine, usually albendazole, is given every 6 months according to standard protocols to everyone in the community. And sometimes if the worm burden is lower in the community, the recommendation is for once a year. But this is debatable. If the infestation is below 50%, they recommend once a year. That's important if you have very limited funds, but if the medication is costing just a few cents a pill, there may be a decision made, even if the infestation rate is below 50%, to continue with every 6 months. In places where schistosomiasis is a public health problem, praziquantel is used according to height or weight. This is effective in controlling the worm burden and usually well accepted by the communities. Deworming can be integrated into child health days, events along with immunizations, vitamin A distribution, bed net distribution, and growth monitoring. Albendazole targets the 3 major intestinal parasites: Ascaris lumbricoides, roundworm, the trichuris, which is whipworm, and the Ankylostoma duodenale, which is in Africa mainly, or Nicanor americanus in the Western Hemisphere, and that is hookworm. Other medicines that may be used. Mebendazole 500 milligram tablets can also be used as a single dose treatment of intestinal parasites. For example, sometimes it is more available or affordable. Still follow the Ministry of Health guidelines for its dosing recommendations. Levamisole 80 milligrams can be used for school-age children. Parental 10 milligrams per kilo. If schistosomiasis is a problem in the region, praziquantel is used. Each parasite produces a different set of problems. Ascaris is the large roundworm with a voracious appetite for calories and vitamins. Hookworm is the parasite that attaches itself to the intestinal lining and dines on the blood of its victim, causing anemia. Whipworm is the one that attaches to the rectum, causing prolapse and bleeding. Ascaris. Note the size of the parasite. They can range from 15 to 35 centimeters. That little ruler up at the top of the picture is in centimeters. Ascaris lumbricoides life cycle. Notice a few important things. The person ingests the embryonated egg with the larva inside. The larva hatches in the GI tract in the small intestine, then passes through the bloodstream to the lungs, where it is then coughed up the trachea, swallowed down the esophagus, goes back into the GI tract, matures in the small intestine, causing all kinds of problems, including malnutrition, but many times blockages. It can migrate through the body, causing mechanical issues, blocking places where it shouldn't be. It can become a surgical problem with a bowel obstruction. And as it passes through the lungs, a child or adult can have a chronic cough from the heavy parasite burden, the parasites going through their life cycle, and can cause infiltrates visible in the lungs. So when you hear of a child with a chronic cough or respiratory issues, don't think just of virus, bacteria, or asthma. Think also of the possibility of Loeffler syndrome with the parasites affecting the lungs. Ascaris at surgery. This is a surgical photograph. The Ascaris can actually be a major surgical. Couple more pictures of the Ascaris. And the picture on the right-hand lower corner is massive Ascaris being passed as a bolus. We cropped the picture because the picture of the Ascaris coming out of the buttocks was just a little bit too much. The aberrant migration of Ascaris, when a child is sick, the Ascaris become hypoxic and they become more agitated, and they are known to come out the mouth, the nose. This is an ugly sight. And it is well known to people living in places with a high incidence of Ascaris infection. The mother just has to pull the Ascaris out the nose, discard it, but it is very frightening to see. That can happen. The aberrant migration of the Ascaris can happen after treatment as well. Next, we're moving on to Ankylostoma duodenale, which is the most common hookworm in Africa. This is the hookworm prevalence globally. The intestinal hookworm it comes into the body through the skin. So the larvae are in the mud. The person steps into the mud or sits in the mud. It goes into the body. Then it takes its passage through the circulatory system back up to into the lungs, up the trachea, down the esophagus, and matures in the small intestine, where it is sucking the blood of the host. Now, there is another, and the different hookworms are more prevalent in different parts of the world, but they can be interchanged. There's another hookworm that is not necessarily, the human is not an obligate host. It is usually animals, dogs and cats, but the human, when stepping into mud that is infected with the larva, can have the penetration of the skin and then get cutaneous larva migrans, which you can actually see the worm moving under the skin of the person. This is not the intestinal parasite. I'm only including this kind of as an FYI. The whipworm, Trichuris trichiura. The life cycle, the embryonated eggs are ingested and they go into the intestine. They then pass into the rectum and they also pass into the large intestine, and the place that you're most likely to see them is attached to the rectal mucosa. They can cause a lot of bleeding. The child can actually become shocky. The rectum can swell and the child can have prolapse of the rectum. When you ask a group of mothers in places with high incidence of trichuris, ask if they've seen the rectal prolapse and do they know what to do about it. Many of them have seen it. It's happened to their own children, and they know they have to just push the rectum back in. It is sometimes called a coconut cake rectum. The entire community should be dewormed. Now, this is the correct. Children over age 1 and all adults can be dewormed. Now, in some countries, they do not allow children to be dewormed below the age of 24 months. So, for example, that is the norm in Tanzania. So, although the World Health Organization claims that it is safe, if the Ministry of Health won't allow it, then the people working in that country have to follow the norms of the Ministry of Health. Also, the same is true for pregnant women. In some places, no pregnant women are allowed to be dewormed. In other places, the deworming can happen, for example, with pregnant women after the 3rd trimester. If we just deworm school-age children, then we're missing the younger children who are defecating in the environment and contaminating the environment. Also, the adults are contaminating the environment, and the children who are not in school are contaminating, they're getting contaminated, and they are contaminating the environment. Always include the children who are not enrolled in school, even if you're doing the deworming in school. Make the invitation open to the whole community. Now, we're going to talk about schistosomiasis, which is not usually addressed in the setting of intestinal parasites unless it is a big problem in that part of the world. And in Africa and Asia, schistosomiasis is a much bigger problem than it is in the Americas. although there are places in the Americas where it should be included, attention to schistosomiasis should be included in uh, treatment of intestinal parasites. It can be done in the same kind of an event. It affects about 260 million people worldwide and is considered the most serious neglected tropical disease. Um, Depends on who you read. Some people say it is more deadly than malaria. It is widespread in certain areas, causing a large amount of human suffering. And For example, in Tanzania, there are estimates that 80 to 90% of the population is infected. Schistosomiasis is a unique disease and tends to be very serious in communities that are in proximity to rivers, lakes, and irrigation systems. The life cycle of schistosomiasis, the person gets infected, inoculated with the cercaria by being in fresh water. The cercaria lose their tails when they get into the human body, and then they become the schistosomia, goes through the blood circulation. They migrate to the portal blood in the liver and mature into adults. The male and female there then pair, and they are mated for life. And the lifespan of this paired male and female, some people say can be as long as 40 years that they're continuing to produce eggs. The problem is not caused so much by the larva as by the eggs. The paired worms migrate to the mesenteric venules of the bowel and rectum and to the venous plexus of the bladder. So the person is experiencing their issues related to the venules around the bladder and also around the bowel and rectum. The eggs that are in the that are being produced by the male and female cause a lot of problems in the human. They don't just cause malnutrition and decreased peristalsis in the bowel. They also cause, as they pass out of the into the veins of the bladder and the bowel. We'll talk first about the bowel. They can go up around the portal circulation, causing portal fibrosis, portal vein fibrosis. They can bypass the liver, go into the right side of the heart, be pumped into the lungs, causing pulmonary hypertension. They can go through the perhaps imagine somebody with a PFO, persistent foraminal Those little egg bundles can go into the left side of the circulation, be pumped up to the brain, causing strokes, causing if the emboli go to the spinal cord, they've been known to cause paralysis, spinal cord damage, and now into the genital area. The eggs that are around the bladder venules can penetrate through the bladder, puncture the lining of the bladder, and be excreted in the urine back into the water. The ones that are in the bowel can be defecated into the water, and then the life cycle just continues. But while in the urogenital tract, the chronic irritation from the eggs can lead to bladder cancer, urogenital dysfunction, sexual dysfunction, chronic dysfunction both in male and female. In the female, there is a very big problem of chronic urogenital schistosomiasis with vaginal discomfort, chronic cervicitis, and it is felt that both in the male and the female, the chronic urogenital irritation increases the transmission of HIV/AIDS, HIV causing AIDS. There is increased risk of cervical cancer. So this disease is huge in all age groups. Children as young as infants have been known to be positive for schistosomiasis from their first encounter with being bathed in water that's contaminated. Many people spend their entire working lives in the water as farmers or fishermen. Uh, the women often doing laundry, bathing children, the children swimming, doing household chores. The contact with fresh water, either at the source of the water or as it's being brought into the home and used in the home, carries the risk of passing from the water into the human body and causing a huge amount of suffering. I forgot to mention cirrhosis of the liver. So these things are very serious public health consequences of the schistosomiasis. People are infected during routine agriculture, domestic, occupational, recreational activities which expose them to infested water. Children are often infected by swimming or doing their chores. Now, if people go to a physician or a travel clinic, they're often warned if you're in North America or Europe or any developed part of the world and you're traveling to a place that is for which schistosomiasis is a risk, you will often be warned not to swim in fresh water, and this is one of the main reasons why that warning is. Taking a bath can infect a child. Doing daily chores. Notice these families coming here for their water. Blood in the urine is a common sign of schistosomiasis of the type hematobium. There are 5 types of schistosomiasis that infect humans. The Schistosomiasis mansoni, Schistosomiasis japonicum, and Schistosomiasis hematobium are the most important ones. They are all treated with praziquantel. Schistosomiasis control focuses on reducing disease through periodic, large-scale population treatment with praziquantel, and a more comprehensive approach includes potable water, adequate sanitation, and snail control. All of those things would reduce transmission. The snails in fresh water are obligate. Now, when you're planning your deparasitization, first think safety. Above all, do no. Wash your hands with soap and water if you touch the child's mouth. Also have the children wash and the mothers, because in many cases you'll give the pill to the mother who places it in the child's mouth after reassuring the child, or if you're crushing it, she'll help you to have the child drink the liquid. Never put a pill in the mouth of a crying child. Do not coerce, threaten, or unnecessarily frighten the child. Treat him or her gently and with patience. And a child that is regularly treated for worms is more effective in school, grows and learns better, is more resistant to other infections. This is the WHO PowerPoint for deworming programs for teachers to participate in deworming the children. They mention that children who get dewormed learn better. The things that you need, your praziquantel pole. Now this is the older version of the pole. The new pole, revised version, goes down to 84 centimeters, goes down to 60 centimeters. You'll need a pole, or if you're going by weight, a scale, clean drinking water, cups, and your mebendazole or albendazole and praziquantel. You can use albendazole or mebendazole, praziquantel. They're safe and effective. Teachers can easily and safely distribute the drugs. How to do it. Make a line. Register each child. If you use the praziquantel, you take the height and weight to determine how many tablets. These are old pictures here. Albendazole, that's how to use the albendazole. And the albendazole, you have to have a different sheet, or you have to amend it if the norms of the country you're working in don't allow you to go down to 12 months. So you see here we're posting the norms for Tanzania, for example. If you are using the praziquantel by height, the tablets are always 600 milligrams. You can go anywhere from a half a tablet to 6 tablets, because you can see this, the top here is 5, but for a person who's overweight or obese, you add an extra tablet. Because so many children and infants are infected with schistosomiasis, they should be included in the mass drug administration that is done in high-risk communities. It now goes down to 60 centimeters. Adults should be included. And to prevent underdosing of large people, you give overweight and obese people more of the medication. Now, it's a little tricky for the person handing out the pills to always know underneath all of the clothing people are wearing what is their actual body size shape. So have people self-indicate what they feel their body shape is to help you to give the extra large people that extra dose. Give albendazole in the appropriate dose for the child's age. Provide water, and make sure that every child chews and swallows a tablet. They have to show you that they have not chipmunked it. Don't give albendazole to infants less than a year old, and follow weight or height guidelines for pregnancy. For children from 1 to 3, some people say up to 5, or however old that child needs to be to chew up the pill. You crush the tablet, mix it with water, have the mother help the child to drink, give the vitamin A capsule at the same time, and don't risk choking by forcing the child to take a medicine until they're calm. You don't want them aspirating either the pill, the vitamin A capsule, if that would fall into their mouth, or even the liquid with the medicine in it. For children older than 3 to 5, have them chew the tablet, swallow, and then show you that they have only a little residue in their mouth. Any child or adult can have the tablet crushed. Teach hygiene. The community needs to learn how to protect the water that is used for drinking and bathing, to wear shoes, dispose of human waste properly, keep animals away from homes and children, and much more. When habits change, deworming programs won't be needed anymore. Schistosomiasis would not continue to be a human health problem if people would not defecate into the water or into areas that run into the fresh water. If a person chokes on the tablet or any object at any time, perform the Heimlich maneuver. For a summary of pediatric instructions, refer to the WHO Pocketbook of Hospital Care of Children charts, which follow. How to manage a choking infant. Lay the infant on your arm or thigh in a head-down position. Give 5 blows to the middle of the infant's back with the heel of the hand. If the obstruction persists, turn the infant over and give 5 chest thrusts with 2 fingers on the lower half of the sternum. And if the obstruction persists, check the child's mouth for any obstruction that can be removed, and if necessary, repeat the sequence with the back slaps. An older child, turn them over your lap, back blows to clear the airway in the choking child. Give 5 blows to the middle of the child's back with the heel of the hand, with the child sitting, kneeling, or lying. If the obstruction persists, go behind the child and pass your arms around under the child's body. Form a fist with one hand immediately below the child's sternum. Place the other hand over the fist and pull upwards into the abdomen. Repeat this Heimlich maneuver 5 times in their rapid upward thrust. If the obstruction persists, check the child's mouth for any obstruction that can be removed, and if necessary, repeat the sequence with back blows. Thank you.